This video is a movement analysis and a biomechanical breakdown of the squat. Well, squat is a fairly basic Olympic lift to complete. It can be found throughout all different sports and is very important for healthcare professionals to be familiar with mechanical flaws that could put their athlete at risk of injury. Whether an athlete is stepping to prepare for a cut in soccer, jumping up to get a rebound in basketball, or performing your basic Olympic lift, it's very important to have a sound biomechanical standpoint of the squat in order to get maximal muscle recruitment and minimize risk of injury. The squat can be broken down into two different components, your lowering phase and your lifting phase. As you go into your lowering phase, the first thing that's going to happen is a hinge at the hip, which is going to be hip flexion. As that butt goes out as if you're sitting in a chair, you'll be going into knee flexion. And while that foot is going to be stabilized on the ground, there will be some dorsiflexion as you lower yourself toward the ground. Once you get to a point of parallel or past parallel, it's ideal to come back up in the lifting phase, which is going to be the concentric phase of the lift. Here you'll be completing hip extension, knee extension, as well as ankle plantar flexion. As you come back up in the lifting phase of the squat, the major agonist muscles that you're going to be using are your glutes and all four of your quad muscles. The synergist muscles that will be assisting in this lift are your hamstrings, your calves, as well as muscles in the erector spinae group. Throughout the lowering and the lifting phase, you're constantly going to be stabilized by your stabilizer muscles on your front and posterior core, such as your transverse abdominis, your rectus abdominis, your multifidus, and your internal and external obliques. As a healthcare professional, it's very important to look out for major flaws in an athlete's form. The flaws that are going to stick out the most are anything that goes outside of that flexion and extension motion. While we're trying to stay in a straight line this entire time, and the exercise should take place in the sagittal plane and the frontal axis, it's important to note that there's not too much ankle inversion or eversion, no knee valgus motion, and especially as they go down into the lowering phase of the squat, you want to make sure that their heels aren't rising up. This can either be due to a lack of mobility, range of motion, any sort of muscle imbalance, or anything that's going to cause an athlete to need to compensate for this motion. It's very important to look out for these flaws, to nip them in the bud right away, and to give your athletes a sound, strong biomechanical analysis of the squat. There are going to be different cues that you can give them, such as keeping that chest upright, sticking that butt out, trying to stay in a straight line as much as possible. Obviously, this will change depending on the type of squat that they're doing, whether that's an Olympic lift with a high bar, doing a front squat. It will also change depending on your stance, whereas a more narrow stance is going to keep your torso more upright, and it's going to use your quads so that you're not falling over or leaning back too far. A more wide out spread stance is obviously going to use more of those hamstring muscles as you come up, and it's not going to be worried about keeping that torso such upright, and you don't want to be worried about falling over or anything like that. But as a healthcare provider, it's very important to understand the biomechanical analysis of the squat to give your athlete the best cues possible and to get the best results that you're looking for.